My practice that people pay primarily cash for, the price has gone down every year for 15 years. Contact lenses, it's about $4 a contact in my office, almost the same as Walmart. Why? Because I have to compete. I don't want to be the same as Walmart. I wish I could charge as much. Everybody in business wishes you could charge whatever you want. You can't because there's competition. LASIK surgery, it's much more expensive, but people still pay cash for LASIK surgery, and the price has gone down every year for 15 years. Competition works. You need to figure out how to get competition and capitalism into healthcare. Well, this debate is almost like it's way over the head of anybody in Washington, because they're not even having this debate. Their whole debate is, how much government are we going to add to the system? I say the primary question you have to ask before you even get started is, what's wrong? Is it because we have too much capitalism or too little capitalism? Is it because we have too much government already or too little government? You have to start the debate at the beginning to decide which direction to go. I think there are some answers. One of the answers is what I have. I have a health savings account. So I pay a lot less for my insurance than people who have low deductibles. But even mine, my prices are rising dramatically. I have a $5,000 deductible, and my prices are going up 17% a year for my premiums, even though I pay for 99.9% of my health care through cash. But if everyone had health savings accounts, you would pay cash. You'd learn to appreciate your dollar like you do in every other facet of the economy, and you would drive prices down. People say, I don't want to pay. I like my $10 copay. If you like your $10 copay, don't complain about your $1,000 a month premiums. Because that's why you have low copays, you have high premiums. The other thing about it is and this is counterintuitive to people, but if you were forced to pay $150 for your doctor's visit, but we took away price controls, or we didn't set the prices any longer, you would force the prices down. Because let's say you're diabetic and you have to go every year to see an ophthalmologist. You would choose it maybe based on quality, but you might say, well, I've heard good things about this person too, and you might call and say, well, he charges $130 or she charges $120. Price competition works, and it would work in healthcare. We have to figure out how to bring it in. But how do you help things like pre-existing conditions or portability? I say we tie the insurance to the individual and not to the employment. I say we try to make health insurance more like term life insurance. I have term life insurance, and if I have a heart attack today and I survive, my term life insurance doesn't go up because I have a multi-year contract. I have a 20-year contract for my term life insurance. It's based on my age, and it goes up a little bit every year, but it is not going to have anything to do with my pre-existing condition of now having a heart attack. But my health insurance, even though I have a $5,000 deductible, if I have a heart attack today and I survive, they'll triple my rates next year because I have a 1-year health insurance plan and I'm part of a small pool of 3 employees. We need to allow people greater access to larger pools. You should allow me to buy it through some association of physicians nationwide. You should allow insurance to be sold across state lines. You should allow more competition. You should allow more and expansive health savings accounts. They're limited. I think I have the highest one, but there's no reason why some people might buy $10,000 and $20,000 ones. Let's say you're one of the people who make more than $50,000 a year and you buy no insurance. It is smart to have insurance. Everybody should have some kind of catastrophic insurance. But let's say you want to take a chance on $20,000 deductible. You might be able to get a $30,000 deductible. And people say, oh, that's crazy. Well, you might get it for $300 a year, and you might make that trade-off of paying $300, $400, or $500 a year to have a very high deductible. And then you might, if you got hit with a $20,000 bill, you might borrow money for that, or you might do whatever it takes, or same way with your car. We don't prepay our car repairs. We pay for it as we go, and we have insurance against catastrophe with our car, a large automobile accident. There are ways around this question. There are ways to fix health care that involve bringing capitalism into it, bringing the profit incentive into it. It works everywhere else. Why can you go to Walmart and buy a Go phone for $14? Because people pay cash. In health care, consumers and patients have become disconnected to the product. We need to connect the consumer to the product where they pay directly for it. It's not that we won't have insurance. You still will need insurance for higher items, but we need to develop a marketplace. But like I said, it already works a little bit with health savings accounts. I used to be at a multi-specialty clinic, and it was $12,000 for insurance. But I chose to keep my health savings account. I have my 3 kids and all of us on for a little over $4,000. And for many of the last 10 years, I was under $4,000 a year for health insurance with a high deductible. And it works. But we have to figure out how to make it work. We also have to figure out how to bring that marketplace in. One of the interesting things is in my practice, nobody cares about the price. I don't largely, and neither do the patients, because no one's paying. But you know who does care about the price? And the only time that I really go overboard to try to care about the price is if you have no health insurance. Because then you come in and I will try to negotiate a rate. And I have many people. We have Mennonites in our area. They're good people, and for religious reasons, they don't buy insurance. I try to work with them. They actually know how to do it. They call up and say, I need this done, and what does he charge, and what will he charge if I pay him in advance, pay him at the time. There are some advantages to me. I don't have to file insurance and do this, and I try to charge them a comparable rate. But you know what? The system's kind of broken. If you go to the hospital and you have no insurance, you know what they charge you? 4 times what everybody else gets charged, because what they do, and what many doctors do, is we charge a really large amount as our charges because we don't want to miss anything that an insurance company might pay us. We don't know sometimes exactly what they'll pay us, so we'll charge $2,000 for cataract surgery, but Medicare might pay $600, and Blue Cross might pay $700, or Humana. But then you come in, you have no insurance, you get a $2,000 bill. It's not very fair. On a personal basis, I try to make it fair, but the hospitals sometimes don't understand that. And then sometimes there's rules that say, well, that could be fraud if you're not sticking to what your actual prices are. Now, I do it in my clinic through Alliance Eye Clinic, so I try to take care of people who don't have insurance, and I give them a lower price. And I can do that legally, I think, because it's a charity program and we have them sign up for it. But we need to change some rules. It's illegal in many states for doctors to publish the rates. Just dumb. We need to change those rules. We need to change the tax structure. We need to allow more health savings accounts. In Obama's plan, though, they have health care exchanges where only certain insurances will be sold. We did that in 1994 in our state. We had health care reform. 35 out of 37 insurance companies left the state and quit selling. Where are they going to go, though, if we make the whole country that way? In the bill, they are taking away tax incentives for health savings accounts and letting you use health savings accounts less under Obama's bill. They say they're not going to take my insurance away, but if I lose it or want to change companies, all of a sudden, guess what? It's not approved because they have to be approved. They also want to make insurance where everybody pays the same. It's this Cuban type of idea, this egalitarian idea that everyone should pay the same. So if I work out every day and walk and eat carefully and I'm not a diabetic and don't smoke, I still have to pay the same as someone who's not taking care of themselves. But they're going to mandate that by the government. They asked Nancy Pelosi recently, well, where do you get the constitutional justification for health care, or dealing with health care? And Nancy Pelosi said, what? She was, the what? The Constitution. And she finally said, oh, the Commerce Clause. The Commerce Clause is good for everything. They asked, Judge Napolitano asked Representative Clyburn, he's a representative from South Carolina, about this, and he said, well, most of the things we do up here are not approved by the Constitution. He just readily admitted that it really has nothing to do with governing anymore. It's about majority rule. If they have 51 votes in the Senate, they get it. So we have to think about changes that are outside the box. So far outside the box, it's not just opposing Obamacare. It's talking about what should we propose as conservatives or Republicans or independents. What should we propose in Washington? And some of the things I'm talking about, you don't even hear the Republicans talking about. We need someone up there who will talk about market reforms and the way we can allow the marketplace and capitalism to function. It functions everywhere else, and there's no reason why we can't get it to work in healthcare. Thank you very much.